Hey guys, welcome to my channel. If you missed my video from last week, my name is Alex. I am a licensed esthetician, small business owner, and newly licensed registered nurse. If you missed that video, click this link and watch the one from last week. So my dog decided to take a nap right at my feet while I'm filming. So if you hear little snores, it's my pup. But anyway, so just to give you guys the update, I am officially in my second week of my critical care residency. That means I made it through the first week and I'm gonna tell you guys all about it. So if you missed the previous video, just to catch you guys up, I did do 2 weeks of my general orientation for residency, and that was just 2 weeks of just the general stuff. It was new grads, transitional nurses, experienced nurses, just all of us lumped into one group, and we did just 2 weeks general orientation. Now to tell you about my first week. I have my schedule here on my laptop, so I'm just gonna tell you guys exactly what we did. We have been doing our classes pretty much Monday through Friday, 8 to 5. They're all on Zoom and they're all different topics, from patient care to different disease processes. The first day we just went through a general orientation just about the classes we were going to be taking, what our schedule was going to look like, and things like that. So that afternoon on the first day, we did a class that was just an intro to caring for the critically ill patient. So this class was just telling the important differences between being a med-surg nurse, being a critical care or progressive care nurse, and what the differences are in terms of nursing care. So to give you guys just like a very quick overview, basically the main focus of that class was just the importance of watching your patient's trends. Because we're caring for patients that are critically ill, they change status very quickly. So it's really important to watch your patient's trends so you can kind of get ahead of something that could possibly go wrong. Like if you're seeing their blood pressure continuously going down, you want to make sure that you catch it before it gets really bad. And the quicker that you can catch something going wrong with your patient, the quicker you can choose the proper intervention to help and get your patient back to their baseline. So that was just the main topic of that lecture, just being on top of your labs, making sure that you do a full head-to-toe assessment on your patient every single time you start a shift, so that you have a baseline and you can kind of see when things are changing and you're quick to do something about it. On Wednesday, our first lecture was just a head-to-toe assessment. I'm not really going to talk about that because that's something that you go over at length in nursing school. After that, we had lectures on alarm fatigue and pain management. So basically just how to avoid alarm fatigue, which is getting desensitized to the alarms going off. You want to make sure that when an alarm is going off, it's like, and you're responding to it. So the last lecture of that day was 4 hours of assessing and managing oxygenation and ventilation. So we had 2 days of this lecture, so it was 8 hours in total. And that lecture was basically on the different machines, ventilation, different settings and things like that. So aside from learning the different types of machines and ventilation and weaning off of ventilation, we learned about specific disease processes and oxygenating them. So a really easy example is when you're dealing with a patient who has COPD, you want to make sure that you're not over oxygenating the patient. So when you have a normal patient, you want to make sure that you keep their O2 sats, 95 and higher. But with a patient who has COPD, you want to make sure that you're keeping them at their normal. So if you hyperoxygenate this patient and you're trying to get them from, let's say, a 90, a 91% oxygen sat, and you're trying to get them to a 95%, you're actually going to throw their body out of whack because they're going to try and overcompensate. That's too much oxygen for them. So it's very important. Oxygen is considered another drug, so it's really important how you manage it. Something I forgot to mention in my first video is that aside from all of these classes that we're doing on Zoom, we also are assigned echo modules, which I will share a little bit here, and you can see kind of what they look like. The following day, the first 4 hours of the day were dedicated on doing pulmonary echo modules. So they assign them and they are due on a deadline every week, but they really can be completed on your own time. Later on in my afternoon, I had a lecture on ARDS, really awesome lecture. A lot of what was talked about in that lecture was actually proning your patient. So I guess because of COVID, now it's been shown in evidence-based practice that proning your patient is actually good for not just COVID, but a lot of other respiratory disease processes. So the main focus of that lecture was definitely proning your patient. I'm gonna include a picture here that just kind of shows why proning your patient is good. My favorite little saying that I've heard lately is face down, sats up. Love it. I may be cheesy, but I love it. So the rest of the afternoon, we had a couple more hours left to do modules. And the next day, which was Friday, so the last day of the week, thank God, because I was definitely feeling it. We had 4 hours in the morning to do cardiac modules, and then our second lecture on the oxygenation and ventilation that afternoon for another 4 hours. Overall, my first week was great. It is so much information. I mean, a lot of it is repetitive. It's things that you learn in nursing school. It's disease processes that you should know about, but it was just really draining. I mean, the hours are long, sitting in front of the laptop, you know, for 8 hours a day, being in and out of lectures. It's definitely a lot of information, and I'm definitely nervous about feeling kind of like mentally overloaded. I'm not sure if I'm going to be able to take this knowledge and apply it when I do have to take care of a patient. And the scary thing is that I'm not really going to know until I get out there. I mean, you graduate nursing school and you have so much knowledge, and you really don't know if you know until you have to apply it. So I'm just kind of like, and I got the text from my manager with my schedule for April of when I'm actually going to be on the units. I am so excited. It's like, finally, like, I know I'm a nurse. I have a license. I went to nursing school. I passed the NCLEX. I got a job. I'm a nurse, but I haven't actually had any patients as a real nurse. So I'm like, this is it. So finally, next week, I am going to have my next video, and I'm gonna share my schedule, my lectures for next week, and my first day of work on the unit. And I am so excited for it. And I'm even more excited to share it with you guys, because it has definitely been causing me the most stress, and I don't know what to expect at all. I don't know what they're gonna expect of me. So of course, if you like this video, give it a thumbs up, and then I'll know you like it and I'll make more. And make sure you subscribe so you don't miss any videos, and I will see you next week.